Hello everyone. Let us talk about breathing difficulty in children today. The possibilities in younger children are something called as viral bronchiolitis. The child has developed a fever and runny nose, coryzal symptoms, and then in 1 to 3 days progresses to have a persistent cough, fast breathing, some amount of dehydration, or associated breathing difficulty like we mentioned. This could be a viral bronchiolitis. In slightly older children, it is very difficult to differentiate between a viral-induced wheeze and an asthmatic attack. Both can occur with viral illness, can occur after exposure to dust or smoke. However, a viral-induced wheeze is often seen in a younger age group child, and symptoms are not persistent, and there could possibly be no previous history of similar complaints. Whereas asthma most often occurs in children who have a previous background. They may have history of eczemas, and the complaints are episodic and persistent. Now, breathing difficulty, as we said, could be something very simple, and home remedies such as steam inhalation also can relieve a blocked nose, which will relieve breathing difficulty. However, if you feel that the child is having some amount of breathing difficulty which is not settling with home remedies, or is associated with a persistent fever and a cough, sudden onset or unexplained onset, then it is better to get the child checked out and see what is the cause for breathing difficulty. Now, once you approach your doctor, some of the common questions that could come your way include: what is the onset? How was the onset? Was it a sudden onset? Was it an acute onset, or the symptoms have been persisting for a long time? Is there any previous history of similar complaints? What is the age of the child? Was there any other family member affected? Is there any history of allergy or asthma in the family? This could give the doctor vital clues to diagnose viral-induced wheeze, bronchiolitis, or an asthma. Now, it is particularly important to remember when breathing difficulty is of a sudden nature. You notice that the child was playing, and half an hour later, 1 hour later, the child is choking or having severe breathing difficulty. This often points to choking on a foreign body, and it means that you need to rush to the doctor to have it checked out. The doctor will then assess and make a diagnosis of a foreign body, or it may be related to an infection also. Sometimes what happens is an exercise can trigger asthma. So even in these cases, there may be a sudden onset of respiratory or breathing difficulty. So one needs to be very sure, and may necessitate further tests such as X-rays to rule out choking on a foreign body. If you are worried with a child who is having breathing difficulty at home, please present to the Aster Whitefield emergency, where a doctor will examine, assess, and treat you for the breathing difficulty. I hope this answers some of the questions which relate to whether a child with breathing difficulty needs to present and be examined and assessed by a doctor. Thank you for watching the video.